Hi, it's Eileen with Biga, and something about walking in this neighborhood just seems to inspire me to yap my head off. So, I'm gonna talk a little bit about what is on my mind today. Um, I think what I'm thinking about today is the downfall of therapy and the things that happened over the course of my 30 years in this field that have turned it into the factory work, nothing against factory work, that it is right now. The first thing is, which is a byproduct of the fact that healthcare as a whole is about nothing but money anymore, is the focus on productivity. I know we're all going to relate to that, but productivity, while it's understood that companies have to make money, but to have therapy be all about productivity puts the therapist's mind in a place where it's not supposed to be. A therapist and any healthcare person is supposed to look at their patient and go, okay, what does that patient need to go and succeed and do the things that they need to do? Whether it's a doctor thinking, all right, what kind of medical procedure do they need? Or the therapist, how do I teach them to be able to transfer and be safe in their house? Your mind needs to be on the task. But nowadays, I'd say very rarely is a therapist's mind fully on their task. And no offense to young ones, but they really don't even know what that means, because in the forefront of their mind at all times, every minute of every workday, and a lot of times off it too, is I need this many minutes. If I don't get this many minutes, I'm going to get fired. And that's not an exaggeration, because if they don't get their minutes too many times, they will be fired. So when they walk in to see Mrs. Jones, they're not looking at her and saying, Mrs. Jones lives alone, she's going to have to make her own meals. What do I do to facilitate this? They're thinking, Mrs. Jones gets 23 minutes, which it could be 23 minutes or 46 minutes. How I have to fill that time. And that's all of it is. That is not conducive to good creative therapy that achieves goals and helps people be safe at home. Okay, that's the one big problem. The second thing that happened to therapies and healthcare in general also, that is related to productivity, is point of service documentation. Point of service documentation is fraud, because we're supposed to be providing skilled therapy. Skilled therapy is what we're supposed to bill for. If you're on the computer and you're typing, that's not skilled. And perhaps in certain circumstances, a little bit of point of service is not a bad thing. But what it leads to is a room or a gym with 5 therapists in it. One therapist is standing people, the rest of them are typing. While they're typing, the patients are sitting like this. Just sitting there. They're just sitting, because the person's mind is on what they're typing, not on the person. I also think, and in the recent past, I had 2 occasions to go to doctors. And both times they were doing point of service with me, or in the other case, my daughter. And what it seems to me is, in both of these situations, and they were nice people. No, I'm sure they know what they're doing. That the goal of the session, the goal of their time with me was to fill in the boxes, to fill in all the little boxes on their computers, to come to some conclusion to tell me. They weren't looking at me, or in my other case, the daughter. They were not looking at us. They were not questioning further to find out this or that. The one was better than the others. They were filling in blank to make sure that, first of all, that was all done when I left, and to come up with some document that makes a company happy. Because ultimately that's what we're about now. We're about reimbursement. We're not, and this is an aside, but none of our documents are for patients. Okay? All that stuff is to please another entity so that they give us money. And that is the priority now, is to fill this in so that it pleases them, so they get paid. It's not really to look at this person who's right over there and give them what they need. Because let's say your documentation was for the patient. That would change everything, wouldn't it? Wouldn't that change everything? But it's not. So the patient is really incidental. And I know a lot of patients hate therapy, and I think that's why. It's because they get pushed on down there and then they sit a long time while their therapist is busy typing. I know when I went to the doctor in these last two things, that's exactly what I felt like. And one of them, I was with my daughter, it was potentially serious. I mean, it could have been a big thing. And he was real nice, but it really felt as though his mind, while he was caring and better than some, was primarily on all of this. Now, it's nice to have that there, but how do you pick up the nuances when you're not looking at the person? Okay. And the third thing I think that has really screwed up therapy, related to the other two, is exercise bikes. I think the exercise bike, in and of itself, is a good thing because you can do all those reciprocal movements, builds up endurance and strength, but a bike is a very good way to keep somebody busy, keep them over there, make it look like they're doing something while you type. I have literally seen people on bikes for 30 minutes, maybe 40 minutes. I've seen people sleeping on bikes. I've seen people sliding out of their wheelchairs with their foot stuck in the rungs of the bikes. Just all kinds of things. And as my friend says, she says when she gets old, if you stick her on a bike, she's going to be screaming, which isn't going to help anything. They're just going to give her an Ativan shot. But I really think that these three things, all stemming from the fact that healthcare is not about patients, not about helping anybody, not about gain. It's all about money. And that these three things, productivity and point of service and the exercise bike, have really turned therapy into a non-creative type of, and I don't say this as a slur, but as a factory work where the focus is, just making money for the company. The patient's irrelevant. And I hope, we're in a very strange time right now with this virus going around, all these healthcare workers out there. And I hope that witnessing all this, I hope it makes us see the problems that we have. I hope it makes us see that all of us, the richest among us, are only as healthy as the poorest. I hope it makes us see that, the person in the restaurant, the person in the grocery store, these are important. Everybody is as important as the next one. Another thing relating to therapy again is there's a lot of really not good things happening to healthcare workers during this virus time because of the corporate bent of healthcare now. For instance, I read the article about that doctor telling people how they don't have enough PPE and everything, and he went to work and they got fired. And okay, you don't want to speak about your company, but what does that mean when it comes to healthcare? That means that companies don't have to give you PPE. They don't have to do things properly. They don't have to work to a high standard. They don't have to serve their patients. And if healthcare workers have to be afraid to get fired because they out these things, well, then they're afraid for their jobs and then they don't out it. And what does that mean? That means that your healthcare could be whatever those companies want it to be to make money. There's no accountability whatsoever. And I think a lot of us therapists are noticing right now how unimportant we are to our companies. A lot of the companies, and I'm not singling any out because I listen to everybody and I go a lot of different places and I'm not even speaking any in particular, but a lot of companies forbid their staff to wear masks, for instance. They're not allowed to quit if they're pregnant. They're not allowed to there's no protection. It's from the comfort of their home. the heads of these companies are telling the therapists, and this goes for nurses and all other healthcare people, what to do out there. They're not at risk. The person at the top making these directives is not at risk because they're safely at home. But they're telling all these people out there in the front lines what they can and can't do for safety, and without equipment, without just with disregard. And I think it's really, really sad and eye-opening to see how these companies value us. A lot of therapists have gotten letters during this virus time about productivity and get your productivity. A home care company sent out letters to home care therapists. Oh, how are you guys going to keep your productivity up in these times? Really? People are dying. You know, people have children at home. They're going out without protective equipment, going out to take care of people. And I don't know about you, but I'm not confident that all the people we see that are supposedly don't have the virus. They're not testing. And I feel that, and this is kind of sad, but I'm not fully confident that they would tell us about all the people that would have a virus, this one or anyone. Because who's going to want to treat that person? There could be problems, so they're just not going to say. And I don't know. But I think it's a level of sort of mistrust that makes many of us feel like that. So anyway, this is my little rant about the decline of therapy. And I think during this time, we need to have a reckoning, and we need to make our governing bodies, our licensure boards, and our organizations, I think we need to hold them accountable. They set up all these things we're supposed to live to, and then we don't. Or we're forced to do things that are wrong. And I think we need to make another reevaluation of our companies and what we want them to be and what we expect of them. And I think when this is done, I hope some actions are taken. All right, everybody, stay safe, and thanks for listening. Bye.